Our health service is recognised the world over as one of the very best, and it is the best because it attracts individuals who see working in it as a vocation and not a job. Our nurses, support staff, and all those who make the health service work day in and day out do so because they're committed to providing excellence. They are true heroes who deserve our respect for their selfless service, supporting us when we most need help. This is why I'm very, very angry about the way our local healthcare professionals are being mistreated by our MPs at Westminster and by the failure to deliver a government at Stormont. This needs to change. Our nurses and healthcare workers should be amongst the first to receive improved pay and conditions. They should never be put in a position where they're forced to consider striking. I know this goes against the very core of what they believe. If I'm returned as your Member of Parliament on December the 12th, my first action, when a cabinet is formed at Westminster, will be to call for legislation to bring our health service in Northern Ireland under direct rule. This has already been introduced in the House of Lords by my party colleague Lord MP and must be passed without delay. This will allow a direct rule minister to reinstate the parity of wages, stopping this ridiculous two-tier health service that DUP and Sinn Féin ministers have facilitated. It is wrong that they have allowed our local health service staff to be paid less than their colleagues in the rest of the United Kingdom. This legislation will also allow a number of key decisions regarding our health service to be taken, reducing waiting lists, improving recruitment, updating skills, and easing the burdens placed on hard-working health service staff. It is unfortunate that such action is needed, but the DUP Sinn Féin impasse at Stormont means those two parties elected to represent you have failed to deliver on education, health, housing and employment. Instead, they argue over who is to blame for not forming a government. When you selected me to be your voice at Westminster in 2015, I worked tirelessly to look at ways that the United Kingdom and its devolved regions can best work together. That's why I'm asking that once again we work together on December the 12th and ensure South Antrim has a voice in Westminster that represents everyone. And righting the wrongs in our health system is just the start.